32 questions, actually 4 quadrants of question. This episode of Ask Dr. Darwin, we're going to be talking to board-certified pediatric dentist, DrTrudyAnn Frazier, and we're going to be learning a little bit more about her journey to becoming a dentist, what a typical day looks like as a pediatric dentist, and some fun facts. So stay tuned. Hey, this is Dr. Darwin, your new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, becoming a dentist, getting into residency, and then life as a new dentist. Guys, be sure that you are staying all the way through to this episode, but also sharing this content and liking and commenting as well. All of those things help us disseminate this information to your friends, your colleagues, and it's free. And there are ways that you can support us, all right? Look down in the link below. You can see there's ways that you can support us with merch, but also we're just sharing and adding value to this content. So comment, leave your comments down below. If you have any ideas that you want us to explore or topics you want us to explore, put those ideas also in your comments below as well. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, the ultimate resource to help you become an advanced trained dentist, whether it's to become a pediatric dentist, an orthodontist, an endodontist, an oral surgeon, etc. So if you want to get some help in getting your application together and getting your interviews prepared for that big day, go ahead and look at the link down below. Get into dental residency in the link below, and we'll see you in the training soon. So today, 32 questions. This is a very fun way of learning a little bit more about our colleagues in the oral health profession. It's a very video series where we ask questions that highlight different dental specialties and focal areas within the profession to gain insight to life as a practicing dentist or oral health professional, or even a resident in training. What would you say is the hardest or most challenging procedure that you have completed or you're working on, that you have worked on as a pediatric dentist?
So I interpreted that question a little differently, because in peds, the procedures themselves aren't necessarily difficult. Now, I will say this, and don't judge me, because somebody's going to say, well, that's why she didn't become an oral surgeon. I have had some second molars, some primary second molars. So that's A, J, K, and T, kick my butt. I will say that.
And why would you say that? What about those particular cases made it hard?
You're such a teacher. I love that. You're such a teacher. So those teeth have thinner roots. And if you remember from your dental school anatomy, the roots of those second molars wrap around the crown of the permanent premolars. And sometimes they're ankylosed, or sometimes they're just fused, and they're so thin that you think you're going to break the root. But the key to that is to elevate. Listen, I don't even pick up my forceps until that tooth is in there dancing like this. That was a dental move. I don't pick, because I know if I do, the roots are gonna fracture. And if it's a small amount of root that's there, just leave it, because you going in to elevate that, you may end up pushing the permanent tooth away and then causing a different problem. So it's almost best that if it's not easy, if the roots of the primary teeth aren't easily retrieved, then it's best to actually leave it, inform the parent or the guardian, and take an x-ray so that you can document it, because that tooth in the future, it may get pushed out by the permanent tooth and you can just take it off, or it may get resorbed by the body depending on how big it is. So that is one thing. But I would say most of our procedures aren't challenging. The patient behavior, the behavior management, I would say, is what makes pedo hard. Because if it's a small, I don't know, buccal resin on 30, but there's an operculum there, so there's lots of blood, lots of bleeding, you're having a hard time isolating, and then your target is moving like this. It's more so the behavior management that's hard with pedo, not necessarily a lot of our procedures.
Yeah. In your practice setting where you are now, what would you say is your most routine or most common procedure?
Well, we have a heavy hygiene office. So we do a lot of hygiene, but in terms of operative procedures, I would say fillings and stainless steel crowns, pulpotomies, your basic operative pedo procedures, fillings, pulpotomies, crowns. Yeah.
Okay. Any very memorable procedures or treatment plans that you participated in or comprised that once you had it done, it gave you like one of the best feelings as a dentist or as a provider? Any memorable cases like that?
Yeah. I lecture, and she's in one of my lectures. There was a young lady who had the sweetest spirit, and she just was really cognizant of her smile. And I was able to do some cosmetic procedures on her front teeth. And the level of gratitude that she expressed, she was actually being bullied. And she was like, "Oh my gosh, I can smile again." And she was, you always know that a patient, or even like adult or a kid, is insecure about their smile when they laugh like this and they cover their mouth. And I literally watched her when she first walked in, just very subdued aura. She looked down, she didn't make any eye contact, and it was because of her front teeth. And when we fixed them, that was the first time I've ever seen her smile from canine to canine. I may have even seen some premolars in there. I mean, Dr. So I remember her, and I think we changed her life that day.
Absolutely. Transformative. Transformative. And I bet you if you were able to document her, how she was emotionally and how she presented visually with this and heads down or looking away as a before, and then doing the same thing as an after, that in itself is probably one of those things that explains how that can give you the greatest feeling as someone who's helping transform someone's smile, but also transform their life, right? So again, another reason why oral health matters, you guys, right? The transformations that go on that affect not only intraorally, but also spiritually and emotionally as well.
Yeah.
But this has been a sick, as in very informative opportunity. Thanks so much for your sharing your answers to 32 questions with a board certified pediatric dentist. Guys, go to the next video right now. Go to the next video. Love, peace, and smiles. Go to the next video. Go.